Today we will be discussing antihistamine drugs, and study of antihistamine drug is very important, especially in the management of different types of allergies. What you should know early before going into studying the pharmacology of antihistamine drugs. So you should know the release of histamine, its physiological roles, you see, and of course the causes of allergy and how they are being triggered and how the release of histamine is there. So your physiology tutor might have told you about the role of histamine, its release, its triple response, and so many others normal physiological response of the histamines. So these are our objectives, and primarily we will be focusing on the pharmacological actions of antihistamine drugs. But before going into the studying the antihistamine drugs, mast cells, you see, in certain cases there is mastocytosis, meaning increase in the number of these, what you can say, cells, you see, and this mast cells that secretes, you see, there is abnormal growth lesion on skin like bumps and spots which may become blisters sometimes, you see, and this is a local mastocytosis. Maybe there are maybe systemic if the response is systemic, and then it can be a problem for you, especially the response is generalized, and risk of anaphylaxis is there. So anaphylaxis is a massive antigen antibody reaction, type 1 antibody reaction with the release of histamine, 5-hydroxytryptamine, heparin, and so many other substances like slow releasing substances of anaphylactic shock, and that will be an emergency. So that's a typical a different story. But the scientist says that mastocytosis is having a genetic aspect as well, and which is out of the domain of this lecture. So what releases the histamine? The release of histamine may be number one due to the chemical agent, and number two due to the physical agent. And these are the agents that secretes mean the release of histamine from the mast cells, you see. And in case of physical agents, there may be mechanical trauma, radiant energy, thermal energy. They can also trigger the release of histamine. But nevertheless, certain drugs response related to the release of histamines, particularly these narcotic analgesics, that's very important, and some drugs like reserpine, tuberculin, and some toxin of and venoms that trigger the release of histamine. And that is why in insect bites, the antihistamine drugs can be useful to manage some of the symptoms that is associated with the release of histamine. So that depends that how you are going to revert the histamine action. And so the action of histamines can be reverted by three different ways. And number first one is that so agents that decrease the release of histamine from the mast cell, like glucocorticoids, cromolone sodium, and the agent that stabilizes the mast cells, perhaps, you see. And there are some other drugs like Zetofen from Novartis Pharma, and that is going to stabilize the mast cell, you see. And ketotifen is a drug that the generic drug that is going to ketotifen, and that is going to decrease or stabilize the mast cell, and the release of histamine is inhibited. There is once the histamine is released, it goes and work at different receptors, you see, and therefore certain drugs will compete with the histaminergic receptors, and they are called as antihistamine drugs. So the action of histamine can be prevented by receptor antagonism phenomena through the antihistamines. But keep in mind, once the histamine is released and attached with the receptor, then it is very difficult to dislodge from the receptors, and probably this could be the reason that if a reaction is started, then it is very difficult to revert that. So the third one is the physiological antagonism. Like you see, when histamine release is there is bronchospasm, there is bronchial secretion, and the parasympathomimetic-like activity is there, and adrenaline is a beta 2 receptor stimulant, you see. So it is an adrenergic agonist. Adrenaline is adrenergic agonist, whereas histamine is a parasympathomimetic agent. Therefore, adrenaline will antagonize the physiological action of histamine, but working at different receptors, and this is called as physiological antagonism. So, so what is an antihistamine? An antihistamine is an agent that's going to counteract or antagonizes the effect of histamine. How? For example, there's histamine receptors present at the different receptors in the cells, and that with that histamine, the antihistamines drugs will come and will occupy. For example, if this is histamine receptor, H1 receptor, you see, so, and this is a histamine. So, what is antihistamine? Antihistamine will have the same specificity, affinity, and that comes and attach with the histamine receptors. So, what will happen? This antihistamine will attach, whereas it will dislodge. You see, the histamine will have no time to attach with no opportunity rather to attach with the histaminergic receptor. So antihistamine goes and attach with the histaminergic receptors, and thus the histamine won't be able to come and bind with the histaminergic receptors. That is why these are also referred to as H1 receptor antagonist. Antihistamines are classical H1 receptor antagonists. But how it works? They work through in case of allergies, there is hypersensitivity reaction of the antibody class, you see, and 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 IgE, which are located on the mast cells in the tissues and the basophil cells that is present in the blood. So when an allergen comes and attach with this antibody IgE, so antigen antibody reaction is completed, and this leads to the release of histamine from these cells, from the mast cells. Consequently, this may, if this response is massive, acute, so it can create big problem in shape of anaphylaxis, and if it is low, so it can be managed, but still it can create problem for you, and this will come in, you will come across with different type of allergy. You see, mast cells, in fact, in the mast cells, histamine is distributed throughout the mast cells, and it is present in the peripheral tissue of the body and basophil, which circulates in the blood, as I reported in the previous slides. Remember, the physiological role of histamines, just to recall you, that histamine causes the inflammation by increasing the vasodilation, capillary permeability, causing the bronchial smooth muscle contraction, especially like constriction is there, mucus secretion is increased, is typical parasympathomimetic activity, and parasympathetic nerve stimulation is there, and this can create problem for your patient. So why is this important? You see, allergies are very common in developed countries like UK, USA, and you see, allergies are the sixth leading cause of chronic diseases, and that can cause the healthcare system, produce a big burden on the healthcare system. Therefore, the role of the antihistamine drugs is very important. This is how from histidine, in the presence of histidine decarboxylase enzyme, where carbon dioxide is removed, you see, and this will lead to the synthesis of histamine. So your physiology to thermometer have told you, and this is receptors are H1, H2, H3, and H4. But primarily we are focusing on H1 receptors, and they are coupled with G protein, and transferable quantum protein, and that activates phospholipase C, and subsequent release of you see calcium and histamine from the muscles, and then that the effect is that increase the vascular permeability and inflammatory inflammatory materials, that inflammation is rather favored, and that is produced by the histamine, you see. So it triggers the allergic response, nausea, and the sleep disorder may be there, you see. So if we are going to use antihistamine drugs, so antihistamine will go and block the H1 receptors, and then you can thus treat your patients suffering from allergy. So next target is to teach you about the pharmacological actions, doses, and safety profile of these drugs. But regarding the pharmacological actions, so the first action is sedation. Remember, there are first generation and second generation. The first generation have more sedative effects, and children are irritated instead of sedation. This is a technical point to remember, and this is the problem that sometimes the self-medication can create a big problem, especially in children. You give them antihistamine drugs, and instead of sedation, they get irritated. You see, and irritability is there, so it can be a big problem. The toxic doses produces seizure in some time, you see, and the second generation is free of these side effects. This is a technical point to remember. Regarding anti-Parkinsonism effects, second effect is the anti-Parkinsonism. Diphenhydramine is suitable for the dystonic effect of antipsychotic side effects. Thus, it suppresses the extrapyramidal signs and symptoms, you see, that usually observed with antipsychotic drugs. The third pharmacological action is that these drugs have anti-nausea and anti-emetic, especially they are helpful in the management of motion sickness. And but remember, it has to prevent it. This is used prophylactically. If the motion sickness started, then it is difficult to revert it. So this is a technical point to remember, because because if it is started motion sickness early, then it will be difficult to manage. So if you are going to use these class of drugs for the treatment, for the prevention of motion sickness, so give it at least 1 or 2 hours before starting the traveling. Regarding the antimuscarinic action, in case of antimuscarinic action, so what is important? The first generation of antihistamine drugs have atropine-like effect, and remember, it has an effect on the peripheral muscarinic receptors. This could be beneficial, especially in rhinorrhea. When your patient is suffering from rhinorrhea and there is excessive nasal secretion is there, and this can be helpful because it will make the nasal secretion will be decreased when you use antihistaminic drugs. It has atropine-like effect. But the point is that if your patient is suffering from benign prostate hypertrophy or hyperplasia, so the most frequent side effects will be the urinary retention. So it may aggravate this situation because of having anticholinergic signs and symptoms, and there may be a blurred vision as well, and dryness of the sclera, you see. So sandy eyes may be one of the adverse effects of these antihistaminic drugs. uh, the most important one is next is the adrenal receptor blocking agent like effect. You remember, phenothiazine groups have alpha blocking activity. This is a technical point to remember, alpha blocking activity. And there is orthostatic hypotension. You see, and even if you use this with adrenal receptor blocking agents, or like prazosin, tirazosin, so the effect will be potentiated, and therefore the chances of orthostatic hypotension is more once you are going to use phenothiazine groups anti what you can say antihistamine drugs. Serotonin blocking activity is also there. H1 receptor blocker, especially cephaloheptadine, has appetite stimulation effects, and this is because of the serotonin blocking activity. The next pharmacological action is a local anesthetic action. Remember, the diphenhydramine and promethazine has more local anesthetic effect, even more than procan. Procan is classical local anesthetic effect. This can be beneficial in certain clinical conditions. The other effects may be that the H4 effects are histaminergic receptor type 4. Their effects are facilitated as to inhibit the P glycoprotein transfer found in the cancer cells, and therefore it can be very good in the management of tumors as well. But this is still under process and under investigation. So primarily the above effects, as we discussed, like local anesthetics, adrenal receptor blocking agents, serotonin blocking activity, antimuscarinic action, sedations, anti-Parkinsonism effect, anti-nauseating effect. You see, all these are classically related to H1 receptor antagonist activity. So, what is important? This slide tells you that the first generation antihistamine and give you the second generation antihistamine, but we are primarily focusing on the safety profile. Especially these are the different classes, and you see the more frequent sedation that is with the phenothiazines like drugs, and this effect is much more what you can say evident in the next slides. So here you can see this is the subclass of the first generation. You see we are now in first generation. Alkylamine is the subclass, and chlorpheniramine is there, tretinoin, pheniramine. But look at this. These are the doses you have to remember, and this is the dosing interval, that how frequent you will administer this drug. At least the effect remains for 4 to 6 hours, so you have to repeat after 6 hours, 5 hours. This drug's chlorpheniramine will add. But its potency is plus plus, and plus plus mean it's a moderate activity. So among the activity, it means as antihistaminic activity, the most prominent one is that of promethazine, and you can see that other derivative. But the anticholinergic effect is predominant, especially with phenothiazine, and the anti-emetic effect is predominant with phenothiazine and piperazine. So 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 these drugs can phenothiazines and piperazine can be used in the management for the what you can say nauseatic effect, for the nausea. But the problem is that it has a strong anticholinergic effect as well, and this cannot be given especially to the old age patient with benign prostate hyperplasia and too many other clinical conditions. So so the most higher incidence of sedation is with promethazine, you see. So this can be helpful in certain cases. And there is another subclass of ethylenediamine, you see, and there is ethanolamines, you see, diphenhydramine, which is Benadryl available in the market. This is the single daily dose, and the effect starts for 6 to 8 hours. So you have to repeat it at least 4 to 3 times a day. And this is the dosing, and this is the what you can say the potency mean moderate acting H1 receptor antagonist, but again it is very high very high anticholinergic effects, and of course the anti-emetic effects can be helpful, especially in management of motion sickness as well. This is the second generation antihistamine class, and usually it is termed as miscellaneous ones because they cannot be classified like that of it based on the chemical structure, ethanolamine, miscellaneous, or ethylenediamine, or alkylamine, phenothiazine, and piperazine. Why? Because they have different structures, especially the second generation here. That is why it is placed under the subclass that is miscellaneous. And estimazole, terfenadine, loratadine, cetrazine, these are the drugs. But remember, they have almost the same potency, but they are having a long duration of half-life, so their dosing interval is usually they are advised once a day or twice a day. But and you can see there is no anti-emetic effect, so less or negligible what you can say anticholinergic effects and the sedation. Same is true for this is the least sedative or free of sedation. This is their claim, marketing claim, and they have a potency what you can say from high to very high level of potency, you see, and therefore these class new second generation of antihistaminic are used these days for the management of different types of allergy. Thus, the therapeutic uses of antihistamines are what you can say you can use it in allergic rhinitis, in allergic conjunctivitis, like in pinkish eye, you see, uh, allergic dermatological condition, urticaria like hives, angioedema, and pruritus, anaphylactic reaction, even anaphylactoid reaction as well, and nausea and vomiting you see, and you sometimes it is used for the sedative purposes as well, and the adverse effects. Sometimes the first generation, especially, they are associated with the anticholinergic effect and sedative effects. You see, but sometimes it can produce irritability, especially in children as well. And these are the classical list of the adverse drug reaction with the H1 receptor antagonist, especially. mm, uh, that is the sedation is there, tinnitus is there, blurred vision, euphoria. Look at this. It happens sometimes, and and the newest second generation H1 receptor antihistamine drugs are more selective, and they are free of anticholinergic effect, and they are free of the drowsiness as well. Therefore, they are usually advised for those persons so which run the heavy machinery or they are pilots, etc. So are driving. So then nowadays we are preferring the second generation H1 antihistamine class of drugs. These are the references. I hope now you understand what are the adverse effects, therapeutic uses, and a comparative profile of antihistamine. Thank you very much.